Hospitals, somewhere where few of us want to go very often. The horrors witnessed by those walls can be the stuff of nightmares, not to mention the patients who never manage to leave with their lives. Please be warned, these stories can be particularly gruesome and graphic, and are most certainly not for the faint of heart. It's time to get comfortable, and let the darkness take control. Number 1. I am a nurse. I was taking a call one night and woke up at 2 in the morning for a general surgery call. It was pretty vague, but at the time I lived in a town that had a large population of young military guys and avid meth users, so late night emergencies were common. I got to the hospital, where a few more details awaited me. Perirectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the arsehole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Among healthcare professionals, vague statements like that were a bad sign. My patient was a 314-pound Native American woman who could barely fit onto the stretcher which I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after asking her a few times, just so that I could confirm her identity with her and what we were working on. I figured it was just best that we get her to the anesthesiologist so that we could knock her out and get the circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot. Chronic drug abusers who don't handle pain very well, and who have used so many drugs that even increased levels of pain medication don't touch, simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 8-year-old man tear a 1-diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by a HIV-positive neo-Nazi, and I've seen some other shit. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we like to call them, knife and gun clubs. The surgeon was ex-army, and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen. We got the lady off to sleep, put her in the stirrups, and I began washing the rectal area. It was red and inflamed, and a little bit of pus was seeping through it. But it was all pretty standard. Her chart had noted that she had been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of "Oh Jesus, kill me now." The surgeon stepped up with a scalpel, sinks just the tip in, and at that exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, which is not uncommon in surgery, and with every muscle contraction, she shot more of this blackish grey-brown fluid out onto the floor, until, within 10 minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open, within my surgical mask, watching the second nurse dry heave, and the surgeon standing on tiptoes keeping this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving, mouth still wide open, not being able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't breathe. My lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an ex-NCAA D1 tailbacked, his 6'2" frame shaking as he threw back the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sink outside the door. Another geyser of pus splashed across the front of the surgeon. In all operating rooms everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same. Somewhere there is a bottle of peppermint concentrate. Everyone in the department knows where it is. Everyone knows what it's for, and everyone prays to their gods that they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smell at bay for long enough to finish the procedure and shower off. I sprinted to our central supply, ripping the open drawer where the vial of ambrosia was kept, and was greeted by an empty box. The bottle had been emptied but not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil, and not replaced a single drop of it. To this day, if I figure out who it was, I will kill them with my bare hands, but not before cramming their heads up the colon of every meth user I can find, just so that we're even. I darted back into the room with the next best thing I could find, a vial of Mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but now considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the Mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it, so that he could stand next to his machines, long enough to make sure that the woman didn't die on the table. It wasn't until later that we realized that Mastisol can give you a mild high from huffing it, but in retrospect, that's probably what got us through it. By this time, the smell had permeated out of our OR suite and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself, in case he genuinely needed help. It was like one of those overly artistic representations of zombie apocalypse you see on fan forums. Here is one guy, in blue surgical garb, standing nearly ankle deep in lumps of dead tissue, fecal matter, and several litres of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's arse, and there was no Yoda. He and I didn't say a word for the next 10 minutes, as he scraped the inside of the abscess until all the dead tissue was out. The front of his gown was a gruesome mix of brown and red, his eyes squinting against the stinging vapours originating directly in front of him. I finished my required paperwork as quickly as I could and helped him stuff the recently vacated opening full of gauze and taped this woman's buttocks closed to hold the dressing for as long as possible. Woke her up and immediately shipped her to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% of isopropyl alcohol is about the only thing that could even touch a scent like that once it's soaked into your skin. It takes 4 to 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little bit of it too. After we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together. That was bad. The next morning, the entire department, a fairly large floor within the hospital, still reeked. The housekeepers told me later that it took them nearly an hour to suction all the fluid and debris that was left behind. The OR suite itself was closed off and quarantined for 2 more days, just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing that they've seen. You ain't seen shit, kid. I am a nurse that works in an intensive care unit. I took care of a patient who had a history of esophageal cancer. A while back he had surgery, got better, and eventually went home. Months later, he got pneumonia and came back a while to the hospital in respiratory distress. He had to be put on mechanical ventilators. He was stable, no blood pressure issues, heart rhythm looked great, breathing wasn't terrible, responsive and followed commands. All of a sudden, his blood pressure suddenly drops and he lost his pulse. We called a code blue and began CPR. We brought him back after an hour and continued to run tests to figure out why he crashed. None of the results of the labs or imaging were remarkable. 15 minutes after we brought him back, his blood pressure drops again and he lost pulse. We continued coding him for another hour until it was clear he couldn't be brought back and the doctors pronounced him dead. His wife came in after the fact, and she told me that she couldn't stop thinking about the conversation her and her husband had. It goes something like this. Honey, don't forget you've got an appointment with the healthcare nurse this Saturday. Husband, well, I won't be here this Saturday. Wife, what do you mean you won't be here this Saturday? Where are you going? Husband, I don't know. I just won't be here. This conversation happened Wednesday. He was admitted to the hospital on Thursday, and he died Friday at 11:30 p.m. Verifying deaths is always sad, but my friend tells the funniest story about how creepy his first verification of death was. This is not meant to disrespect anyone. Black humor is a huge part of doctors' coping strategies. He was on night shift a few weeks ago into his first job as a qualified doctor, and got a call from a ward to say a lady had passed away, an expected death, hence he hadn't been called about her before. And could he come and verify and do the paperwork? It's a busy shift, with lots of sick people to see first, so he takes several hours to get there. He goes up, and they tell him that she's in room 8. The door is open and slightly ajar and the room is dark. Now, she was on the inside, but most patients were in shared bays of 6 beds, so you get into the habit of not turning the lights on. In his nervous haste to make sure it didn't look like he was nervous, he slipped into the room, only armed with his little pen torch. The window was slightly open, and he swears the blind rattled against the sill as he crept towards the bed. The tiny circle of light was from his torch, picking out the rumpled white hospital blanket, only a very slim rise showing where she lay, as she was a tiny old lady, just skin and bone. Finally, the light plays over her face, and he's able to bite back a little scream, nearly dropping the torch. For whatever reason, her pose in death is one of a horrified and horrifying snarl, lips drawn back to bare, like false teeth, and the whites of her eyes showing in a fixed blind stare, and both hands up close to her face, curled into claws, slightly over long nails, shining grimly in the meagre torchlight. Now, to verify a death, the doctor has to listen for heart and breath sounds for 2 minutes, whilst feeling for a pulse, and has to check the pupil reactions and check for no response to pain. He flicked the torch dutifully across her glaring eyes, forcing him to shuffle close enough to the torch, first to check for her response to pain, and then settle shaking fingers on her throat, so to close those furiously grinning teeth to feel her pulse. To get his stethoscope underneath the collar of her gown and blankets, he had to lean even closer, almost nose to nose with her now, unable to draw his gaze away from hers, and he has to stand like that for 2 minutes, the seconds crawling away as he stares into that screaming face. He says there's no way he would have heard a heartbeat sound even if she'd been alive. All he could hear was his own racing heart in his ears, and on loop in his head, "Please don't let her move. Please don't let her move. Oh dear God, don't move." I'm not a doctor but a nurse. I work with geriatric patients, and there was this incident about 3 years ago. Anyway, this one time I was working the night shift, and I was super sleepy, so I decided to skip lunch because I was hungry, and went into my car for about 30 minutes. I got inside, covered myself with my sweater, set the timer on my phone, and immediately knocked out. I'm dreaming, but in my dream I'm still awake and just sitting in my car. Someone taps on my car window, and I see that it's one of my patients, D. I look surprised and ask D what the hell she's doing outside, and she tells me that she's looking for her daughter. I tell her to go back inside and that we'll call her daughter in the morning. My patient becomes angry and starts banging on my car window. I kind of freak out and try to reach for the door handle to get out so that I could calm her down, but I quickly realize that I can't move. Let me add that I frequently experience sleep paralysis, so even though I am asleep, I realize what is happening. I fight it and try squirming my body in an attempt to wake myself up. I finally manage to wake up, and my heart is racing and my forehead is a bit sweaty. I sit there for a minute, realize it was all a dream, and roll the window down to cool off. My break is over, and I clock back in and see that my supervisor and 2 other nurses are huddled in front of a room. I am still by the station clocking in, when they see me and call me over. I walk over thinking something was wrong with the ventilator or the patient fell, but my supervisor tells me that D had just died, whilst I was on my lunch break. Since most of our patients are DNR, I was not paged. It took a couple of seconds for this message to register, and I freaked out internally. I got goosebumps, but didn't mention anything to my supervisor about the dream. I was in a motorcycle accident a few months back. I broke my spine and needed surgery to fuse several vertebrae. As they brought me into the surgery, I noticed two men standing in the corner of the OR, looking not at all surgical, clean and entirely out of place. Looking back at it, I later recognized them as my two late grandfathers, one of whom died in the hospital, and the other died during a surgery. The reason I know about my grandfathers is because my parents told me a story, is because they were both in the hospital food court during my 11-hour surgery, and my dad heard his father telling him that everything was going to be alright. He told my mum, and she wasn't at all surprised, because she had heard her father telling her that everything was going to be fine as well, even though it was late and they were the only ones in this dead silent cafeteria. I am a very shy teenager who was scared of people. I was home alone at the time this happened. My parents had gone out to dinner with my aunt and uncle, and then go to some show. My parents were going to be home in about an hour, when I started not feeling great, to the point where I started shaking and fell to the floor. I managed to call 911, and they sent an ambulance. This is where it starts to get creepy. I was unconscious when the paramedics got there. All I remember is waking up, with bright lights flashing and sirens blaring, and someone asking me, "Ashley, are you okay?" The next thing I knew, I was at the hospital where I was taken into this room, with one person who was clearly not right in the head. I was so tired, I felt like I was dying. That's when the lady decided that she was going to come walk over, and started stroking my hair. I was in a neck brace and on a spine board, so it was not like I could move. I just lay there looking at her, and wishing that she'd leave. Then she started to speak. "Hello, Ashley. I will come and hunt you down someday and eat your soul." I was creeped out and started screaming, which caused the nurses to come running in. I told them what the woman had said, and they just blew it off as I was crazy, as she had left by the time they arrived. I was soon moved to an EMU unit for more testing. 3 days later, I was informed I had a visitor, and I was confused because my parents were working and I wasn't expecting anybody. I said okay, because I didn't want to be rude to the people who had come to see me. And 5 minutes later, the woman walked in, and my stomach froze. How the hell did the lady know where to find me? I asked her what she wanted, and she said, I'm just here to give you a hug and look at your soul, so I know that I'll be eating it very soon." I just sat there, like, please get out, you're creeping me out. Soon after that, I started having a seizure, and when I came out of it, the woman was on the bed over me. I screamed and the nurses came back in, and took her away screaming as she yelled, "I'm going to eat your soul. I know where you live, Ashley." It took me an hour just to calm down. That was a month ago, and I haven't seen this woman since, and hope I never do. People are gonna think I'm making this up because it's entirely ridiculous. I'm not a nurse, but I was a CNA, and a telemetry tech for many years. I got floated from my home unit of medical neurology to the ER at least once or twice a month when they were short. We had a man drive himself to the hospital because he was having delusions and decided it would be a good idea to cut off his own penis. According to him, after said penis removal, he regretted the decision. To remedy the problem, he stuck a pencil through the severed penis, stuck it back on the stump, and attempted to superglue the whole thing back together. He tried for a while, and then, when it wouldn't work, he drove over to the ER. He said that God had told him that if he removed his penis as a sacrifice, he would stop global warming. So I guess it was a noble reason for him to do it. And the next night when I returned to work, he had been admitted to my home unit and was one of my patients. Yay! Oh, and just for all the poor guys listening to this, they were able by some huge miracle to reattach his penis. They didn't know if it would ever be fully functional again, but at least he could pee out of it. Sadly though, I don't think he stopped global warming. Hey guys, it's Mort here and thank you so much for listening. I really don't like going to hospitals. I feel I'm pretty sure I share that with many of you. I could not do the job of a nurse or doctor. Those guys are really brave and hardworking. So to anyone who works in a hospital, kudos to you. I could never, ever do your job. I was contacted a little while ago by a subscriber who, unfortunately, has to visit hospitals a lot more than I do. This young man is called Jamie, and sadly, because of his medical condition, he has roughly 4 or 5 years left to live. However, there is a very new experimental treatment which you can help with. Because of course, treatments like this are never free. So, for those of you who feel kind enough to donate to help a guy out, I've left a link in the description. I of course will be donating as well. Thanks guys. And in case you forgot, I've also just launched my merch store, so please be sure to check it out. If you enjoyed today's video, please consider dropping a like and leaving a comment. It's a really great way to help support the channel, and I profoundly appreciate it. And if you'd like to do something incredible to help support the channel further, feel free to visit my Patreon. You can find the link in the description as well as the links to my social media. And if you'd like me to read your story on my channel, you can submit it as a text post to my Reddit or send it to me via email. Both links can be found in the description. But anyway, for now guys, I'm going to sign off. Stay awesome, and I'll see you in the next one.